a bit about a timeline. We're going to hear about our health survey that we were asked to take. And I believe, Dr. Kelly, are you going to do it? Are you starting?
I can start, yes.
Okay, but before we do, I'm going to have you guys introduce yourselves just in case everybody doesn't know who you are again.
I'm Joe Nicholas. I'm the Rockies manager with FDL.
I'm Dennis Bay with the school district.
Dr. Kelly White, I'm the Casper and Natrona County Health Department Executive Director.
I'm Stephen Foster. I'm with Geosyntec, and we're helping the school board.
Good evening, I'm Clay Behound. I'm with the Wyoming Department of Health in Cheyenne.
I'm Ashley Busacker, also with the Wyoming Department of Health in Cheyenne.
You don't get to just say that.
Hi, I'm Dave Folks. I work with Steve Foster with Geosyntec, and we're helping with the mitigation system for the school.
And board trustees?
I'm Ray Cavalier with the Board of Trustees.
I'm Paula Reed with the trustees for a few more games.
Thank you all for being here.
So I'm just going to kind of give you guys a little bit of an introduction to the State Health Department survey, which Clay and Ashley will be talking to you guys about in detail, but just kind of wanted to go back to why we asked the health department to do this study and kind of the different types of questions that we were trying to answer from a public health perspective from the beginning of when this incident started and happened in May. So we tried to answer two questions. And so we have the ATSDR report that was released in September that answered the question about long-term risks. So in May, we found that the school had high levels of CO2 and also high levels of benzene in it. And so when, we were very concerned about both, but particularly the benzene because of the cancer, it is a cancer-causing chemical. So one of the questions we wanted to answer is what is anyone's risk being in that building on a day-to-day basis for getting cancer? So we asked ATSDR, which is the federal agency, to look at the different levels of benzene that were detected and then come up with kind of an estimate statistically to determine what your students' risks are and then the staff members. So that report was released in September. And we can kind of talk a little bit about that. But then the second question that we were trying to answer was what is the short-term risk for human illness for people who are exposed every day in the school? And that's the part that the state health department took over and did the survey that some of you may have participated in. And we tried to reach parents of students and then all staff members. And so they will be going over that portion of the survey and the research that was done. By then just trying to answer the short-term risk. So we did put a lot of information out in September in a public information sheet about the long-term cancer risks, but I know that we haven't necessarily been face-to-face to talk about that. So again, the main concern, and I want to kind of bring you all back to why is the school evacuated? I know it's been extremely frustrating and just a hardship on all of you and your students. But the school district evacuated the building, and rightfully so, because of the CO2 and the benzene. And so one of the main findings of the ATSDR report, and again, this is the report looking at long-term risk, was that they concluded that the events constituted an urgent health hazard. So it was right to evacuate the school, and we're still working on fixing that problem. Now, the statistical modeling that we use to identify whether or not there's a long-term cancer risk, the good news is that the risk was extremely low. We're not really expecting to see an excess in cancer over what a baseline, any population of people is going to have some cancer. We're not expecting to have a higher rate of cancer in this community, at least from the school exposure. So that's good. So on one hand, you're sort of hearing contradictory information, right? You're hearing that the benzene level was alarming, and it was. But the good news is that we don't expect there to be a huge likelihood of long-term health problems. And then I will kind of turn it over to the state health department to talk about the survey. And this survey, again, was just trying to get at short-term symptoms. So some of these symptoms, headache, that, irritated throat, that kind of stuff. We're hearing sort of, we closed the school because people were having headaches. Not exactly. Again, we needed to answer both questions, and we're pretty much at the spot where we've answered kind of both of them. So I'll let the State Health Department kind of take the lead in talking about the survey and the analysis they did on your surveys that you guys completed. So.
Good, thanks, Kelly. Well, I'm Clay again. I guess I'll kind of just go over the big results. So, as Kelly mentioned, we were called after the evacuation, notified of the evacuation, and then the testing that was done subsequently by FDL and others that found the high levels of CO2 and benzene. And of course, one of the questions we were being asked was, what are the longer term effects of exposure to those, to benzene and CO2? That's why ATSDR was called to consult with that. They're really the experts on that. But of course, one of the other questions was, were people getting sick when they were in the building? Did they have symptoms that really would, show up with exposure to CO2 and benzene? So that's really kind of what we were trying to look at, was what was kind of the overall picture of symptoms in staff and students when they were in the building, and then did those decrease when they went to the alternate school after the evacuation. So I'm sure many of you in here probably got one of the emails or the calls from our staff going through the questionnaire. So what we did was to kind of look at symptoms over time. And we looked at symptoms from one time period, which was right after spring break to kind of right before the evacuation. Then we looked at the week before and then the day of the evacuation. And then the third time period was in that alternate school. So the alternate school, we were assuming there probably was no school-related exposures to CO2 and benzene, just see if there was a difference between those time periods. The first time period, right after spring break, we chose that just because we had heard anecdotal evidence and people telling us there was something just sort of different about the building right around spring break time. Maybe it was because the building was closed up for a week. But just something odor-wise was noticeably different. So we thought, well, maybe that's a clue for something we should look at. Then the time period, the second time period was obviously right around the evacuation. We knew from the testing that was done right after the evacuation, there were significantly high levels of benzene and CO2 that we know can cause illness. So asked about that. So overall, the results that we had. So we sent out the questionnaires, did calls, did them online, students and staff both responded. What we found was for any symptom that people reported, just looking at the overall average of any symptom, there were 24 different symptoms that we asked about for those 3 time periods. So the average number of symptoms for time A and time B, so in the Midwest Schools building, compared to when everyone went to the alternate building, it was higher. The average number of symptoms was higher in the Midwest school buildings as opposed to the alternate building. We also then kind of broke it down a little bit further and classified people who reported 2 or more symptoms that really we would expect to potentially be seen with exposure to benzene and CO2. Classified those as symptomatic and the others that didn't report 2 or more of those symptoms as asymptomatic. Looked at the proportion of those as well over time, and again, we saw during time A and time B, when staff and students were in the Midwest Schools building, the proportion of those symptoms was significantly higher than it was when they went to the alternate school. So looked at some other things, tried to break it down further, like looking at symptoms by location that folks spent most of their day in the school, broke it down a little bit by age ranges. We did find that folks that spent most of their time in the junior high, high school, library portion of the school did have higher proportion of symptoms than the ones in the elementary school side. Kind of the same thing with the age breakdown, elementary school side, seemed to report as many symptoms, still did report symptoms, but just not as many as the kind of older kids in the high school area. So and that could just be in relation to not necessarily age, but the location of the school. And the testing that was done by FDL and others after the evacuation, some of the higher readings did kind of come from that library area. So maybe just an indication that those did correlate, at least somewhat. There are some limitations with our study, of course. There were, the symptoms we're looking at can be associated with other things. So we were kind of the tail end of the influenza season, when evacuation, or when spring break occurred. It was kind of during flu season. So some of those symptoms could have been due to flu. We were also hitting the spring allergy season. So of course some of those symptoms could have been due to people having allergies. But overall, our conclusion is, even despite those limitations and potential for other causes of symptoms, it's significantly higher. The symptoms were significantly higher, and especially the symptoms that are kind of correlate with exposure to CO2 and benzene were higher for folks when they were in that building as opposed to the alternate building. So I think everybody's got a copy of the report. We'll be sending that out by email tomorrow to all the respondents of the questionnaires. We have email addresses for almost everyone, so we'll be sending those out, and anybody's welcome. We've got more copies here if anybody needs to take more to give family members or friends or whoever else wasn't able to make it tonight. So certainly we support the actions of the school district in certainly evacuating the building, and then also looking to mitigate the building before staff and students return. So we're happy to answer questions if anybody has any, or if you have more specific kind of personal questions you want to wait till after the meeting. We're happy to meet one-on-one with anybody who has questions. So.
Okay.
We're quite through.
Yeah. That's okay. We'll hang around after the meeting. We can kind of read through the report, and we'll send it out, and I'll have all my contact information when we send the report out to everyone. That way, if you have questions later after you kind of read through it, or have specific questions after looking at it, feel free to get a hold of us.
So both ATSDR's report and the State Health Department's report are public records. So the ATSDR, again, is going to be summarizing the long-term risks that we were concerned about and answering those questions based on the available information. And then the State Health Department's report is also public record and available to anyone. And any one of us would be willing to answer any question that you guys might have. So I think the next thing on the agenda is just update of recent events in regards to the timeline. And
May I ask one question? The idea that there weren't any problems, or you talked about spring break and maybe because the building was closed up and stuff, but have we ruled out 100% that there may have been a longer duration of exposure to CO2 and the benzene from that, besides spring break and forward?
No, the only testing, unfortunately, that we do have that indicates, an acute problem was that testing that was done right after right after the evacuation. So, yeah, from ours, that was one reason why we asked things like, describe the odors after spring break and also right before the evacuation. Those odors that people described were very similar. Yeah, we don't have an indication either way that there was or wasn't, unfortunately.
I think it would be so helpful to have that information and just be able to have indoor air quality, tests going back to really see if something specific happened. But yeah, it's not routine for us to test air in schools in that way. And so as soon as we were notified of a problem, all of that testing was done. And there will be, and Geosyntec will talk about the monitoring plans moving forward. But, so some of that will be collected on a routine basis moving forward.
Okay, I'll stand up if that's okay with you. My name is Stephen Foster again. I'm with Geosyntec Consultants, and we were hired by the school board to help get the mitigation process underway. My colleague Dave Folks is a mitigation expert, so if there are any specific technical questions, Dave is here to answer those. But I wanted to give you an update since our last meeting of what's going on and where we are in our process. The school board and FTL and Geosyntec kind of looked at the options and decided that having Geosyntec do the design for the mitigation system would be the most expedient, the quickest way of getting things done. And so we had our mitigation expert come out, look at the school, do some testing around the school, and based on the work that he did and working with the school board and FDL, we came up with a schedule that has a design phase, and that's already been started. So we've got the design process underway. The building is more complicated, and Dave can go into this, but it's actually 4 different types of construction, and so it's like doing 4 different kinds of projects. So the same project, but you still have to kind of integrate them together on how they work. So that's one of the reasons why the design phase is the way it is. And then following out of that, there's the bidding and contracting phase, then there's the construction phase, and then once it's all in place, there'd be the startup, and then the testing to make sure that everything is working okay. So that's how we developed the schedule that I handed out, Chris handed out for us. We are hoping to take time out of the schedule, but we didn't want to give you a schedule that we couldn't meet or feel that we couldn't meet. Now, it's possible that something else will happen. There are a lot of agencies involved. There are a lot of things that could go on with weather, with construction, with all of these other situations. But this is a schedule that we definitely feel is doable, and we wanted to give you this and let you know that we will try and do what we can to shorten it. But this is kind of, you can see how we got there. We gave as much of the times that we think will be there, get from A to B. So we've also outlined the sort of responsibility associated with the pieces. Geosyntec is working with the school board to make sure that the school board piece happens, and FDL has been very cooperative and put us in contract so that we can work with them to make sure that we get all of their side covered as well. So in a way, you should be aware we're working kind of for both sides in this, but we're predominantly working with the school board. That's our primary focus, and that's why we're doing the design, but not the construction. We'll be overseeing that piece. And I'm sure if you have any questions, Joe's reaction, he's here and he can respond to that. So in addition to that, we met with the Trumbull County Health Department, and we went through what monitoring would look like, what kind of plan we need to have in place, and I'll talk about the monitoring, the indoor air monitoring program later if you'd like me to do that. But I just want to make you aware that not only are we looking at the design, but part of the design itself has to contain the pieces of monitoring so that we can get the design into the overall program. So that if you have a full-time online CO2 monitor, you want that to be effective in the place where you can measure that things are going okay. And that's kind of why we're doing the 2 phases together. So that's what's happened since I was last here. And if you have any questions or comments, I can either take those now, or you can ask me questions after you've gotten some input from the school board.
I have a question. Since there's the design phase, and it's 6 weeks, 4 to 6 weeks, and really it does, FDL's a little bit in it, why is the bidding and contract phase, how come it couldn't coincide with the design phase to, instead of dragging it out? Because it seems like there's some feet dragging going on. And this is because we all are ready to be in our school. We know
that the children's safety is most important, but it just seems like it's being drug out, and FDL is in charge of the bidding and contract phase. Why does it have to be one phase done, one phase and stuff
Yeah,
like
no,
that?
that's-
Why can't it coincide and run side by side?
That's a really good question. We kind of had in mind that that might work that way.
Sure. Yeah. No, that's a good point, and there's, with writing the timeline, FDL is, we're a private entity, and, I think for anybody that's done work for FDL, we're trying to be in the business of putting out the timelines that we're pretty confident in. So we're going to do everything we can to expedite that, and we will be reaching out to some contractors, prior to that. But to some extent, before people can bid, they need to know what they're bidding on, right? So, I mean, there is a little bit of, before we get final bids, people are going to need to have designs so that they're done. But, the intent for us is Geosyntex has worked with a couple of reputable contractors in the past. So hopefully we'll have a short list of folks to go out and talk to and see what scheduling looks like. But one of the other reasons why we had to put a little bit extra time in there is we don't know what contractor schedules are going to look like, right? So if we knew that we could get a contractor in here day one as soon as we were ready to go, we might feel more comfortable compressing the schedule. But it's still unknown what the folks' schedules look like. So that's part of the reason. And then I think, as Steve mentioned, the building, the folks that work in the building, I'm sure they're not surprised, but the building is probably a little bit more complex than folks were originally talking about the design thought. And so another reason for us is we want to keep some contingency in there so that when you run into something which is unexpected, which I guarantee will happen, I don't have to come back to you guys and say, hey, we found this and it's going to be another month. So, our goal is to give you guys a timeline that we hope we can meet, and we'll do everything we can to meet it.
So thank you, that's a good question.
How long is the list of qualified contractors to use? Is that an extended list or is that a short list?
Well, most of the people that do this kind of work started in the radon mitigation industry. And there's a national certification process for radon installation, which our fellow has that certification. But there's not that many people in Wyoming that do. We know of a couple that we worked with in the past in Casper and Cheyenne. So we're going to go to them first off. But then you tend to be looking into Colorado and other places to find more people with that specialized capability.
Okay, well, if you have more questions, I'll be back up. So. Okay, well then let me talk about the indoor air monitoring a little bit. As Kay mentioned, we have carbon dioxide and we have benzene. And benzene is sort of a surrogate for all of the other petroleum chemicals that have been found in the air. And so we proposed to look for both of those kinds of chemicals. Carbon dioxide is something that can be monitored continuously. And so the idea is that we would have certain locations, and those locations will be decided as the design is sort of finalized, but they would be throughout the school in different places. And there would be ways of monitoring to see that the carbon dioxide levels are reasonable in those locations, and there will be action levels associated with if those carbon dioxide monitors were to react, go off, people could know what's going on. And so that would be around the school. And then in addition to that, there are these volatile organic chemical monitors. Though these are not full-time online kind of chemical monitors, they're the kind where you just take a sample and you send it to a lab and you get the results back. And so, because we understand some of the relationship between carbon dioxide and those volatile chemicals, we feel that we can do a good job monitoring for the volatile chemicals by looking at the carbon dioxide. And then we can also collect this additional data to make sure that that assumption is okay. And we propose to do a number of different samples around the school, and we propose to do that sampling prior to any decisions to come back. And then I met with Kelly at the health department and talked about what it might look like to get a second round of sampling before a decision is made to allow staff and children back to school. And if those second round numbers come back okay, then there would be a decision made at that point. And I don't know if you want to talk about that, but basically Kelly, in conjunction with other agencies, would be making a decision about whether the school is acceptable and safe for the staff and children to move back.
They want to mention the vacuum too.
Yeah, so in addition to that, thank you, Dave. The system's run by drawing a vacuum from the space under the school building. And we also measure the vacuum at various locations around the school. And so you can tell if the system is working well, like a radon system, just by looking at the vacuum, the difference in the pressure under the building versus outside of the building where there is no fan operating. And so those kind of vacuum monitors would also be in place to make sure that the vacuum is running under the building in the school. So in addition to the CO2, you have these vacuum monitors also running continuously. So there would be these different ways of ensuring that the whole system is operating. The lights are on, the vacuum's running, and that the CO2 levels are reasonable. And of course, let me remind you, that's in addition to the remediation system that FDL is currently running, in addition to the mitigation system that we're planning and designing and will be operating here. Then we also plan to continue monitoring for VOCs or benzene on a continuous basis throughout a 3-month period, maybe once a month, again to see if it's working, to see if the benzene levels are okay. And then if they're okay, we would propose to reduce the frequency of that kind of monitoring. And if they're not okay, we would propose to continue monitoring at the same level. So we found at other places that if the vacuum's working, if the mitigation system is running, and everything is doing what it's supposed to be doing periodic monitoring is usually acceptable, and we don't usually see any problems after that. So we would give you the plan to review. It would be part of the whole program. You can kind of get a feel for it, to make sure that it's operating and that the monitoring plan we have in place will let you know if there's any problems that show up. So that's kind of where we would go with both the design plan and the monitoring plan. And once the data come back, decisions could be made about when we come back. Okay.
Will the CO2 monitors be permanent and who will monitor?
Yes, so we propose to have them be permanent. There would be some ongoing maintenance of those monitors. There would be a plan to make sure that they operate and that they're maintained. And then the way that we're thinking about this is, we haven't finalized those plans yet, but we're thinking that they would have some point where they could be observed, such as in an administrative building or rooms, so that you could see that there's a CO2, the monitors are operating, and you can see what the values actually are. So we would have those readouts, if you like, places where people could actually just take a look.
Now, would the school or the school district be responsible for doing that ongoing monitoring, or would that be something that would be still contracted out through you and or FDL?
Again, a good question. Haven't really resolved who would be doing that, but the way it sits right now, we think that that would probably rest with the school. That the school would have control over understanding the monitoring system and how that would work. But that's something that would need to be kind of figured into the overall program.
So with the monitoring, the seeing if the air is okay and everything in an empty school, is it going to, how is it going to affect it when we have 150 kids and stuff happening in the kitchen, stuff happening in the shop? And is that going to affect the air? I mean, is that going to?
So the mitigation system essentially operates independently of what's in the building. It pulls from beneath the
So then
building.
it's monitoring down here more than what's in the building itself?
The monitoring would be in the building itself, but the system would work by pulling the air out from underneath the building. So the air inside the building would be what people are actually breathing, and that's what would be monitored.
So if we have a kid spill gas on his pants and walk into school, where's that going to be the difference between the CO2, which benzene is in gas? You know, where's that fine line of
Yeah, so
it's
you
on
know-
the kid and it's not actually in the school?
Yeah, so if some kid were to help with the lawnmower and spill gas on the pants and come to school, that gasoline would evaporate into the school, and people would be exposed to that.
Yes.
If there would be no benzene monitor to set off in that case, because the kind of testing we would do for benzene would be just grabbing a sample. If we were to grab a sample from the room where that kid was sitting, it might show elevated levels of benzene. And we would check the data for the inside the school with outside of the school, and then we may actually see, well, it's higher inside than outside. So if they're not the same, so is that because there's something coming in from underneath, or is it because there's someone brought gas into the school? So those are common questions and common problems that we have to deal with this sort of indoor air sampling. And so we would look at, well, has the carbon dioxide changed? If that hasn't changed, it's likely that somebody brought that gas in from outside. If it has changed and gone up, then it's possible that something's going on, and so we might collect another gas sample, you know, as a follow-up to make sure that, well, it was because someone brought something in, and the levels will either go back down or not. So the fact that you have a hit of benzene really triggers doing more investigation than it does doing anything else. And so in the plans, we typically build in those kind of contingencies.
So is there going to be like a limit set on how the CO2 in the building before we're evacuated? Is there going to be a plan on that?
Yes.
Okay.
Yeah. The ATSDR in their health study, and Kelly can talk to this more too, had some CO2 levels that they considered acceptable, and so there's an acceptable range, and so there would be numbers that would be used to evaluate CO2 levels in a room full of kids in the middle of winter when everybody's pretty active, compared to, you know, what's going on in other rooms. And so if we have the monitors in different locations, we can actually see, yeah, the CO2 is elevated here, but it's not elevated somewhere else where there are no children. Does that tell us something about what's going on? And so those are the kind of things, again, there are action levels. Those actions are usually just trying to understand why that number was higher. And then there are levels where if they get high enough, you would have to actually do something. And those would be published levels that you would see in the plan.
So you did say it will be the responsibility of the school district to take care of the monitoring, correct?
As I said, we haven't really figured that out completely finally at this point, but that is our recommendation. That the school board the school district would take care of that. And then obviously they could work with FDL or whoever owns the oil field to see if there's anything going on, or if it's just something else.
And this would just be my concern. The school board has been amazing, and thank you. Been very good about reassuring us that they had no intentions of closing Midwest School because of this and that kind of thing. My concern being, and especially with the economic turn for the state, we know that it costs more money to run a little school, especially out in the Midwest, busing and all that kind of stuff. And so I guess it'd be nice to be able to be reassured one more time that now we're talking about extra expenses possibly on the school district to keep Midwest School going. At some point, does the school board look at that and say, whoa, now they're costing us an additional such and such? Does that make sense? Because we know that small schools are expensive, and of course, we're going to be the first ones that say, but we're really important and we deserve it. But the idea that these are just more additional expenses that are going on in the school district.
I'm probably not the one to answer.
Yeah. Paula, are you talking about the extra expense of the monitors?
Or just.
That's what I heard.
Yeah, the continuing monitoring and
First and foremost, safety of staff and students.
absolutely.
The numbers that we've heard at this point in time are not alarming numbers. Now, they're not done yet, so we don't know for sure. But, right at this point in time, probably.
Because this is something that's going to have to be done until,
well,
2050, when I'm gone by then.
That's all true.
Right.
That's true. But, at this point, we're not aware of anything that would make us go, we can't do this. And hopefully our economy is going to start turning around again. So that's what we're looking for.
I don't think it'll be a deal breaker.
The 2 rounds of data for reentry, are those done after the mitigation is put into place, and how far apart are those 2 rounds?
Yes, they would be done. We proposed that they would collect the first round once they turn the system on, the next day, and then come back 2 weeks later and collect it again. The same.
Stephen, you were saying that it takes about a week to get the results back from it.
Typically, the VOC that gets the sense of the lab, and then it takes about a week to turn the data around and send it all.
Just so that I'm understanding this, I know this is potential, like you want to try to shorten it if you can. Is Christmas completely off the table now because we've been told, we're on the news, you guys might be in there by Christmas, yay! And we hadn't even heard that. It was a board member saying that. My mom was so excited, and I said, Mom, I didn't even told us that yet. So I don't know if this is the news. Is Christmas or after Christmas, before January, completely off the table? Should we get that off of our minds?
Yeah, based on our schedule, I don't think we could do it. This is sort of our best guess of what we could do.
And can I make just additional comments to that so everybody hears it? Even though they say in April that the school might be ready, it's not going to be student ready.
Right.
No. There's no way that it'll be student ready. And that's coming from the custodial staff for sure, walking through there and stuff like that. And all of the hours and time and how many truckloads that we took in to make Westwood Westwood, or Midwest Westwood, or Midwestwood, all that has to come back.
Right.
And we have to be ready for that to come back after that.
Right.
And we have to be ready before that comes into it. And then that's where I'm going to shoot back at Mr. Bay here and ask him a few questions about. So we have 5 months here. You're telling us 5 months before this is probably going to be over for us. Then we could be back in our school. What's that?
Could be.
Okay.
Pending 2 rounds of data.
Okay. At least 5 months, right, is what you're telling us, at least 5 months. Is it possible after those testing and all that stuff happens that the school district is proactive and we get our asbestos removal done that first part of May? We can go get in our swimming pool, make sure that that's taken care of. So that when we go in there in the mid of May or the end of June or whenever we get to go in there and clean and stuff like that, all these projects are already done for us. I mean, because last meeting you promised that they would be done, and that the money's there. So now I'm asking you, can we be proactive, 5 months worth of proactive, and actually get those done before we walk into the school in September?
So, last time I told you, Darla, that the asbestos will be done during the summer. That has not changed.
Okay, can we do that in May?
We could, but what's more important, getting that done or getting back into the building?
I'm going to say at this point, getting it done so that we can go into a fresh building.
We've said that we're not gonna move unless it's over a break. So I don't see
Okay.
us moving in the middle of May for 2 weeks left of school. So you guys might as well do it all so we can start the new year fresh. Everything done and ready to go.
And we've been asking for a timeline, and we appreciate the timeline. There's no doubt about that. We do appreciate the idea that you're putting realistic numbers up for us. We
Right
appreciate
now,
that.
we are planning to do the abatement over the summer. That will not change. Let's get in the building.
Okay.
Thank you.
I have another thing, when we got off, when it snowed Thursday, when we got off the buses over here, all of our custodial staff are in Casper, working in Casper. So I'm wondering who's in charge of snow removal over here, because it was pretty rough and pretty slick, and my little kindergartner's crumping through it all. So who is in charge of snow removal over here, since our custodians can't do it?
I can't answer that question, but I'll work on it.
Okay.
Okay?
And with that, Dennis, sorry, we have all the housing also that the custodial staff takes care of. So the apartments up to it, and then we have on Navy Road, it blows in so bad and drifts that I've always taken the tractor up there to get those out. So, and we're talking, we are on the road an hour and a half earlier than usual, so it'll have to be somebody or something that can get there quicker.
So when roads are plowed, I'm plowed into my apartment, and I've got extra time to do my job. And she would usually come over with school equipment and dig me out so that I could get my car in and out. And now we don't have any of us out to do that, so that would just be something before the snow gets too bad that we might want to talk about. We could maybe get us out.
Yeah, because I get drift on both sides of my car when it's full housing. And then when they plow, it blocks me in 3 ways, and then I got fence, so I'm blocked in. I don't have a four-wheel drive vehicle, it just goes over it.
What's that? All right. Well, we sure appreciate you guys coming out. We know that we can contact Dennis through the district, and Dennis can contact anybody that we need questions answered from. All right. So if you think of something later, don't hesitate to email either myself or Dennis Bay, and we will work on getting those questions answered.
May I ask just one question? Sorry. One, and I don't know that it would be more helpful to have this information before the meeting, like send in an email so that we can read over it and digest it a little bit, and then come here with the idea. Although some of it's kind of hard to understand, so I understand where you guys are coming from, and you know that's why you're here, is to help us understand it. But you're reading and you're trying to digest it and coming up with these questions and stuff. So the idea, and I pray every day, being a mother that has kids in the building, that the, what's the word, the exposure to this isn't going to be health, cause any health issues. I don't want my daughters to have to deal with infertility. I don't want my daughters and my son to have to deal with cancer at a really early age, like everybody in this room, and even as staff members and adults and stuff. But the idea that we know that we've been exposed, is there a need for documentation, so 15 years down the road, and we have that nasty communication with a doctor that says, sorry to tell you, but we've found cancer. That we can say, well, we were exposed at this point to this. Do you understand what my question is? Is there anything that says, okay, these were the people that were enrolled in the building. We've had things happen in the past at the school district where you had the documentation that said these were the kids that were in the 3rd grade and this happened, and so it just helped with the documentation of the story.
I can answer that as a parent. And
I know
what
you
would
can answer
do.
better than I asked it.
Personally, I would keep everything that we're giving you, all the reports, so the ATSDR report, if you haven't seen that, I can get that out to you all. I would keep copies of everything, keep a copy of the state's report. All of them summarize everything that we found to date from a health perspective. And then I'm not promising you that a doctor that you see here would be able to even know what to do with that information, but you'd hope they'd be able to refer you to the right specialists who can help with that. I would keep everything that we've given you in terms of documenting what happened and what the levels of the chemicals were found when we did do the testing. Really, there was only the one day that the chemicals were in exceedance of guidelines, and that was on the 25th. Well, and then DEQ came in and did a backup sample on the 30th, I believe, was Memorial Day. So there was those two, and they were congruent. They matched. So I would just keep copies of everything, and that would begin a conversation with your healthcare provider about that. ATSDR does do consultation for individual patients with the healthcare provider. So I can get that information. The ATSDR office in Denver would be able to, if that situation were to happen, where the healthcare provider can talk directly to them. And that ATSDR can run certain types of testing and other things that can be done if that were to happen. So, yeah.
The other thing I can share, the state does have a cancer registry. We do monitor that. It's a reportable disease. So we would be keeping an eye out at those levels. We watch the levels across the state every year. And so just rest assured that the Department of Health also doesn't want to see this, and we do monitor that condition. So if something were to come up, we would definitely come back up, have discussions. So that's a little reassurance.
I think it's also something you can take right now to your physician and get it in your medical record, and that way, 10 years from now, you're not scrambling to find the report in a box somewhere. It's in your medical record now.
You know me, don't you?
I know myself, too. I think it's something you could just share with your provider now, just to say, this is something we need to keep an eye on, and if it's something you're concerned about, it's in your medical record, and then that way your medical record will follow you, and it'll always be in there. Now you don't have to try to worry about finding it in a box somewhere 10 years from now when something weird's going on.
And also in relation to your question about being able to digest the information, we'll send out the report. Feel free to respond with questions. You can call us, you can email. If you think of questions even after today, definitely we're accessible to you.
It's just a little overwhelming,
I understand.
Yeah, it is overwhelming, yeah, and that's why we're happy to answer questions that you have after we're done, tomorrow, 2 months from now, whatever. When we send that report out, we'll have all our contact info in there and we're available.
Even when the ATSDR information came out, we put out a press release, public information release when that came out in September, and that was probably the last one that we've done. And just trying to, as an educated person, like who's an epidemiologist by training, trying to break it down into digestible pieces, it took some work because it is pretty technical and talking about the statistics and stuff. But again, and if we can't answer your question, we can get you to someone who can, and that would generally be at the federal level.
So do those reports come to Dennis, to the school district?
These? Yeah, these have been sent out through our public information information routes that's been sent to everybody on our work group that we've been working with. And then I also think Guy Chapman, the mayor, has been trying to get these out to the community as well. So I really appreciate that. If you guys haven't received this information and want to receive it, you can just email me and I can add you to the email list that goes out, because this is all public information. Pretty much everything that we do is public information, so.
I'm sorry, I'm stuck on asbestos. I just have a question. I don't understand the asbestos process very much. That wasn't anything above my pay grade, but let's say we get back in our building in May, great. They start cleaning up, and we're gonna close down again for asbestos for, I mean, are we gonna be back in by August, whatever day school starts, ready to go, or I don't know yet.
So, do you know where the asbestos abatement's gonna be?
Actually, don't.
Darla does. Yeah. And it's in the cafeteria. So,
And in our main entrance.
I'm sorry?
And in the main entrance.
I still didn't hear you.
And in the main entrance. to our
Okay,
building.
is that floor tile lift? Yes. Okay. So if we get back into building, we have those two areas, or two, where that can happen, the abatement can happen, but in the meantime, Darla's custodial staff can be cleaning the whole rest of the building like they typically do over the summertime. And then when the abatement is done, they go into those two areas, or three areas, and get that done. It's just running the course that we try to adhere to.
That answers the question.
Okay, yeah.
Really, if you look at it logically, chances are we're not going to be back in the building this year for school. I mean, but if the custodians haven't been able to do any of their summer work, they haven't been in there for the last 6 months. So they've got a lot of work to do to get it ready. And for me, I just want to know that we're going to be back in there at the beginning of next year. At least we've got something to look at. We know chances are it's not going to happen this year. We might get to have graduation in there. That's a good possibility. That's entirely up to the seniors. But I think it's realistic to think of us being back in our school at the beginning of the 17-18 school year.
And that was kind of where my question was leading, was the asbestos going to alter that at all?
No. It should.
That was summer work that was going to be done anyway.
The only thing that might interfere with this is the lunch program, which we could use the start getting.
It was going to interfere with it anyway.
This one's more for you than anybody else. We were told to bring stuff for one semester's worth of stuff, so
Yep.
please give us a timeline when you have a chance of when we get to go back and get more stuff.
Sure. And we'll work with Dennis and Joe to see when that can happen.
Along with that, Chris, we took out a lot of projectors and installed them in Midwest wood. Okay, so that will have to be also accomplished unless you want to buy new ones just to install. Because you do have
Speaking of things installed in Westwood, did we get our cool water fountain thing with the bottle thing?
We'll see. Any other questions?
That's the whole part of Westwood.
Yes.
When's the next meeting?
Next meeting. Good question.
Are we gonna wait for
answer that kind of guy's question.
So, good question. We're just wondering when it would make sense to give you an update. What would you like to be updated on? And it seems to us that once the design is finished, and so we finish that design phase, that would be a good time to update you on what that looks like and where it's going to be and whether we're able to find contractors that might do that to shorten the timeline. So I would propose the beginning of January.
after the first year.
Anything else? We'll get another meeting set up in January then and let everybody. Thank you all for being here.